We can't wait. We've seen 21 reports under this government and now a Royal Commission. It's time for urgent action.
We're fighting for better staffing in aged care, mandated minimum staffing and skills mix, and that also the financial transparency and accountability.
Our aim is to increase ratios for aged care and to generally increase the politicians' awareness.
To make sure that that message keeps going out there. People keep listening, keep hearing that this is crisis.
Let's be clear, we need to fund these things, but the funding must be directly tied to care. There is no point pouring any more money into a great big bucket that has a gaping hole at the bottom. We need to see where the money's going. Providers need to be made accountable for that money, and the best way is to mandate minimum staffing levels.
We fight every day against a system that is not giving us enough, not giving our residents enough.
Staffing levels have decreased, our patient loads have increased, our residents are getting harder and harder to manage. We don't have the staff, we don't have the time, and every time the government gives us money towards it, providers just build buildings.
These elderly people, I don't treat them as a consumer, I treat them as my family.
That's why we're all here fighting for them, because we are their voices. So we need you as the legislators to do the right thing, not being caught between election cycles and then saying we're doing something for aged care. We need it done properly.
I don't think we would like anything more than for the government to deliver the sort of response that would allow us to get behind it and say, finally, we've got a bipartisan, meaningful response. Until the government delivers their budget, though, we don't really know which space we're going to be in.
If you're not a non-nurse, you don't really understand what's happening. So I think that it's important that they see what's happening. And a story from a nurse is personalised. And so you don't get a true understanding unless you bring people into it.
So I'd often look after 60 to 80 residents on my own, and being responsible for all of their clinical components of care. Often I felt like my registration was at risk, and it's just an unsafe environment for both staff and residents.
Lots of people who are bedbound, lots of people who require two-person assist. If you don't have the staff to do that, then you cannot provide the level of care for the other residents.
If we do not do something now, we're going to lose more people who just can't give anymore.
This is it. And if we are not being loud about this, these Royal Commission recommendations will just sit on a bookshelf if we let them.
The answer is not complicated, it is very simple. Staff in aged care need time to provide the quality care they really want to give.